During the height of the AIDS epidemic, people were sick and dying, and at the same time, many, but not all, were put outdoors. Some families, not all, put them outdoors. The government put them outdoors. There was a small group of San Francisco Black men and women. These Black men and women founded the Black Coalition on AIDS and created Rafiki House for those who were sick and dying. Naomi Gray, Norm Nickens, John Hayes, Doris Ward, Brandy Moore, Jimmy Loyce. People quit, people sue, people run programs with little or no money. BCA Rafiki is still standing.
The funding is actually what caused some shifts. In 2008, housing prices have gone up, quadrupled since the time I was here when I first moved in '99.
When COVID happened, we were out there in the trenches helping people get tested, get their vaccines, so that people knew that Rafiki was still there and still trying to support them.
Moving away from HIV, definitely prevention, more to wellness, because we've had good partnerships with the city. In order to have good relationships, you have to do good work. And I think our reputation as a good steward of taking care of folks has helped create those relationships. We also have a strong advocacy group, so when there's changes or shifts or attempts to defund, we have folks that will come out and go to City Hall and advocate on our part and talk to folks and just let them know the impact of our programs.
I'm a San Francisco native, and being able to be in this position to advocate and push back against the disinvestment of our communities, the displacement of our communities, this long-standing inequities that have happened in our communities is critical at this time. We do not want to look up and see that there's no more Black people in San Francisco.
I started when it was called the Black Coalition on AIDS. Moving away from HIV, definitely prevention, more to wellness, because we're now looking at the whole person, and that's where Rafiki Coalition for Health and Wellness came about.
At Rafiki, I always know that this is a place where I am welcomed, where I'm gonna learn something new, and I really feel connected and a part of the community.
Rafiki means friend. It's just remained the pivotal piece of who we are.
Folks need a lot of times more than just that one-on-one individual therapy. It's connected to food insecurity, it's connected to housing, it's connected to the environment. Providing that whole person care requires other professionals outside of mental health therapists.
Having a safe space to live and kind of get on your feet is a very important goal, because now we're able to get folks stabilized, get them back into the workforce, get them permanent housing, get them medical care, get them the benefits that they need, and graduate from our program and secure housing.
We have a special program for maternal mental health, and that is supporting moms and birthing persons who are pregnant and up to 3 years postpartum.
We went from having to go to different sites throughout the city to having what you would call a headquarters or a central hub for the services, instead of having a citywide health access point that it'd be broken up by community. Us being the Umoja Health Access Point, we were able to get a building, and we're in process of taking it through different phases so that it will be an all access health access point for the African American community. Not only there's cultural competency, but there's also familiarity, and there's trust, and seeing, hey, something that may be very uncomfortable for me, I now have somebody who can look like me, sound like me, speak like me, think like me, and understand what I am going through, work with me through what might be a life-altering situation.
Be amongst people who I don't have to stress and who understand me, and Rafiki does that. They're about the health of African Americans and other people, so it's good to be out here, not having to worry about all the other things going on, take an hour and a half for myself
and focus on my wellness.
I was so in awe of the love when you walk through the door. You know, we fellowship, we eat together, we celebrate together, we meet our neighbors here. Sometimes, you know, in our everyday flow of life, we don't get the opportunity to just kind of stop and take a moment.
It's very important because right now everything is so expensive, and then this makes it a little bit easier for the people who live in the neighborhood and then provide the need that we use.
Having some long-term relationships with some of the clients here has really made me feel like they're actually family. And I think that for them it feels the same way. I went to someone's 80th birthday party recently, went to someone else's mother's 95th birthday party. It really means something to them that we're there. And they actually made me stand up and wave to everybody and say, Rafiki's here.
I feel like Rafiki is growing exponentially. Now we're growing at such a nice rate that we can actually scale the level of services that we're able to provide. I really see Rafiki growing into not just San Francisco, but maybe keeping this model and taking it into the Bay Area.
And we're not going anywhere as Black San Franciscans, as folks that are investing in our community. And so the 40th anniversary story is really about joy, it's about resilience, it's about celebrating all the amazing work that's happened over 40 years.
And I'd like that they can pass this on to their children and grandchildren.
And this community is still here, it's still vibrant, it still stands.